When it comes to bringing life into the world, there is no one-size-fits-all approach. Both traditional hospital deliveries and birthing center experiences offer unique benefits and things to consider. Traditional hospitals are, of course, well equipped with relatively advanced medical technology, and the staff is usually obstetricians and nurses and neonatal specialists and anesthesiologists, and this makes them the ideal choice for high-risk pregnancies or complications that may require immediate medical attention. And we know that traditional hospitals often have neonatal intensive care units for premature newborns or newborns with certain medical conditions, and such hospitals provide specialized care for babies in need. In my first pregnancy, I personally didn't feel very confident about choosing a birthing center. I felt I needed to feel less anxious, and I wanted the reassurance of being in a hospital where I knew that all the necessary medical equipment and expertise were readily available in case something went wrong. And this gave me peace of mind and helped me feel less anxious about any potential complications, even though my pregnancy wasn't high risk and I didn't experience any complications. Birthing centers, on the other hand, have more home-like environment designed to provide a more cozy, relaxed environment for childbirth, and they often have comfortable furnishings and soothing decor, and they are typically suitable for low-risk pregnancies where complications are less likely to happen. For example, for my second time, I decided to go to a hospital that offered a more birthing center-like experience rather than the traditional hospital setting. The moment I arrived, I noticed the subtle, calming ambiance, the soft, dim lights, which was not like a bright hospital environment. I was greeted by a friendly midwife, or maybe she was an obstetrician, and she conducted a non-invasive check on my baby's well-being. She respected my comfort level and didn't perform any invasive dilation check, which was a relief. Before arriving, I had already told them the regularity of my contractions over the phone, which was like 10 minutes apart, so they were prepared for my admission. The midwife reassured me that I had time and even offered me the option of a soothing bath. It was a really nice room with a tub in the middle, so I had a warm bath, and then I was moved to another room, and she even offered us breakfast. After some time, when my contractions kind of intensified, she moved me to the birthing room, which was a relief, to be honest. What I really loved this time was dim lights. I don't know, but in my first birthing experience, there were very bright, glaring overhead lights that extremely bothered me during labor and birth, and I really appreciated not dark, but like the dim lighting situation in this hospital. Overall, I felt like there was less stress and anxiety. The midwife was very skilled and calm, and this was not the vibe I was getting in the traditional hospital where I gave birth the first time. When it comes to pain management options, hospitals generally offer a wide range of pain management options like epidurals, anesthesia, or other medical interventions. And I think birthing centers often focus on natural childbirth and minimal medical interventions. So hospitals are equipped to handle emergency situations, and they follow standardized protocols for childbirth, which can be reassuring in terms of safety and consistency. But when it comes to birthing centers, this may not be entirely the case. For example, at the birthing center like hospital where I gave birth to my second child, I was informed that in case of emergency, I will be transported to the nearest big hospital. Obviously, they already had an agreement in place with this bigger hospital, but still the idea of being in an ambulance and worrying if you are going to get there on time can be unsettling. In my case, I felt that I already had prior childbirth experience, that I didn't have any complications. Most importantly, when I registered with the hospital, they were satisfied with the results of my previous checkups. So I knew that they would not have registered me if the chances of something going wrong were high. Okay, now let's talk about the financial aspect of it. Hospital births are typically covered by most insurance plans. However, giving birth in a birthing center might involve out-of-pocket expenses. Not all insurance plans cover such birthing experiences, and as a general rule, they can be more expensive. So the choice between a traditional hospital and a birthing center depends not only on your individual preferences and medical needs, but also on your finances. If you have low risk pregnancy and desire a more natural home like birth experience and expenses are not an issue, then a birthing center may be a good fit. But if you have a high risk pregnancy or want access to access different types of pain relief or other types of medical interventions, a traditional hospital with a neonatal unit is the safer choice. And of course, you should check with your doctor and consider his or her recommendations to make an informed decision. All right, that is it for today, and I will see you next time.